Well, Alabama's Black Belt is one of the most underserved areas when it comes to health care. In some cases, residents have to travel outside their county for emergency aid. But tonight, more than $1 million in federal funding will help provide the critical care many in the Black Belt need. WSFA 12 News reporter Monet Stevens shows us how that money will be spent.
Healthcare education could look different for the Black Belt within the next few years after a $1.1 million investment.
The pandemic has hit the Black Belt in a really hard way.
Whitfield Regional Hospital is currently the only hospital that specializes in trauma, stroke, and labor and delivery in the region. Congresswoman Terri Sewell is using federal monies to provide better resources for education of healthcare workers through the partnership of the hospital and Wallace State Community College, Selma.
It will allow us to create an opportunity, a school that would become a pipeline for healthcare professionals.
Not only, do we need people, but we need a facility where they don't have to travel to be trained.
By having access to more resources to education, this can keep current and future healthcare workers in the Black Belt to serve a vulnerable community.
I'm a firm believer that if we don't care about home, those of us who are from the Black Belt, those of us who are from rural communities, nobody else will.
These healthcare professionals can eventually help advance Whitfield Regional, along with other hospitals in neighboring counties, in providing the best care for underserved people.
These nurses will train, be able to work with our patients, then go to Thomasville and go to Sumter County, over to York Hospital, and go up to Hill Hospital. We work closely with those hospitals in trying to create the kind of care that the Black Belt deserves.
Monet Stevens, WSFA 12 News, Demopolis.
During the pandemic, Whitfield Regional was the regional provider for COVID-19.